innovators came up with a procedure called the hip resurfacing. We reshape the femoral head and put a cap. And what that allows is it feels like a more natural hip. It allows patients to be more active, and then it saves bone, allowing revision surgery to be easier. When you look at hip and knee replacement, they're two of the top 3 operations in terms of improving people's quality of life.
All within 6 months of the surgery, which took place in February, I was back to my normal lifestyle. I was walking, I was playing golf that summer, I was coaching baseball that summer, and I was playing hockey as early as October that same year again, within just over half a year of the surgery. And the only regret is that I didn't do it a couple years sooner.
I think it sets Southlake apart in terms of an institution and a hospital that is delivering high quality, modern, state-of-the-art surgical treatment options. And the team that we have at Southlake is top notch.